dear learners, welcome to week 3, lecture 12 of our course Child's Growth and Development. And the lecture 12 is Essentials in Learning Motor Skills and Sequence of Motor Development. We are going to cover what are the essential conditions of learning motor skills, what is the sequence of motor development, and there are certain references for your further studies. Dear learners, motor development is one of the most essential foundations of human growth, shaping how children acquire the ability to move, explore, and interact with their environment. It refers to the gradual and systematic acquisition of motor skills and movement patterns that emerge as a result of maturation rather than mere practice. Motor development is continuous and dynamic process of modification, where skills unfold in a predictable sequence, each new ability building upon those that came before it. This distinguishes it from motor learning, which involves relatively permanent changes in movement skills through practice and experience, and is inferred from long-term performance outcomes rather than directly observed. Motor behaviors such as reaching, grasping, and fine finger movements follow a typical developmental trajectory across infants and young children. Similarly, gross motor skills involving the legs, feet, and whole body walking, running, hopping, and jumping tend to appear in a consistent order across individuals. And developmental patterns of everyday functional skills such as self-feeding, self-dressing, and ball-related activities such as throwing and catching. These areas highlight that motor development is both predictable and sequential, governed by biological maturation while influenced by environmental opportunities for movement. Now let's discuss in detail what are the essential conditions or essentials of learning motor skills. Motor skill learning is a gradual process that requires readiness, practice, guidance, motivation, and meaningful opportunities. These skills like grasping, walking, throwing, writing, or eating, they do not develop automatically. They emerge when the child receives the right support, environment, and experiences. Now let's understand the essentials of learning motor skills. First essential condition is whether the child is ready or not. Readiness to learn, whether that age is achieved, that maturation is achieved or not. So readiness refers to a child's physical, mental, and emotional maturity required to acquire a new motor skill. If a child attempts to learn a motor task without being ready, the learning becomes slow, it becomes frustrating, and often incorrect. But when the child is developmentally prepared, that age is achieved, that maturation within body is gained, then the child is learned quickly and with less effort. For example, a 2-year-old may not yet be ready to button a shirt because finger muscles are still developing. However, by age of 4 or 5, children demonstrate readiness as their fine motor coordination improves. A child who is developmentally prepared can learn to button within days, whereas a younger child may struggle for months. Second most essential condition is opportunity to learn. Children require suitable opportunities to explore their environment and practice motor behaviors. Many children, especially in overly protective families, protective parents, overprotective parents, they are denied the chance to climb, run, scribble, explore objects due to parental fear of accidents. Without appropriate exposure, natural motor development is delayed. For example, if a child is never allowed to use scissors due to the safety concerns, their hand muscles and coordination needed for cutting paper or small clothes, eventually writing neatly, may remain underdeveloped. On the other hand, allowing supervised use of child-safe scissors provides learning opportunities. Now, the third condition is opportunities for practice. Practice is one of the strongest pillars of motor learning. The more a child practices, the more refined and coordinated the movement becomes. However, it is not the amount of practice, but the quality that matters. Irregular, poorly guided practice leads to bad habits and inefficient skills. For example, a child learning to throw a ball needs regular, structured practices. If they practice randomly without any guidance, they may continue using incorrect arm movement. But if they receive consistent opportunities and helpful corrections, they gradually master accurate throwing technique. Just like learning handwriting daily, short sessions with proper guidance help more than long but irregular attempts. Good models. This is also one of the essential conditions for motor development. Children learn motor skills through imitation. When they see their peers and see their adults, parents, how they are performing, they are doing that particular activity. Having good models, parents, teachers, peers, or older siblings helps them observe correct movements and replicate them. Poor models may lead to poor learning. For example, if a teacher holds a pencil correctly, demonstrating proper grip, children are more likely to imitate that posture. But if a child sees someone holding a pencil with a tight fist or whole fist and rather than just the two fingers, one your thumb and the index finger, instead of doing that the whole fist, if someone is using, sibling or the parent, they may copy the incorrect grip, which later affects writing skills. Similarly, in sports, children often imitate the way older children run, kick or jump. Hence, role models play a powerful role. Next essential condition is guidance. Guidance helps children avoid developing wrong patterns and learn the skill correctly from the start. It also prevents errors from becoming habits that are difficult to correct later. Guidance does not mean doing the activity for the child. Parent or sibling or the elder one is not involving in the activity. They are just guiding, scaffolding and supporting. But supporting them through demonstration, verbal instruction and gentle correction. For example, when a child is learning to swim, a coach guides them by holding their body in the correct floating position and correcting arm movements. Without such guidance, the child might learn inefficient strokes making swimming difficult, and it is unsafe also. Even simple skills like tying shoelaces require demonstration and repeated guided attempts. The next essential condition for motor development is motivation. Motivation keeps children engaged in learning motor skills. Children learn better when they find the activity enjoyable, rewarding, or meaningful. Motivation can come from personal satisfaction, peer appreciation. Oh, good, you are doing good. Yes, keep it up. Teachers, parents, they motivate using certain rewards like, yes, well done, you can do better, this time it's okay, next time you can practice more. Confidence building after success. So, this motivation is very, very important for motor development. We can see it in by example, a child learning to ride a bicycle feels excited because it gives independence. Praise from parents or friends, you did it, without any support. This particular sentence or the 2-3 words like you did it, it's good, marvelous, wonderful, boosts motivation further. On the other hand, if a child feels criticized or compared negatively, they may lose interest and they avoid practicing that particular skill again. Motivation also helps children persevere through difficult tasks such as improving handwriting or learning dance steps. And the next essential condition is each motor skill must be learned individually. Motor skills are not general. Each requires unique pattern of movement. Learning one skill does not automatically teach another, even if they appear similar. For example, holding a spoon is different from holding a pencil, even though both involve hand grip. Each skill has its own motor pathway in the brain, requiring separate practice and mastery. For example, a child who learns to paint with a brush cannot automatically write neatly with a pencil, because painting uses large, broad strokes relying on arm movement. Writing requires more refined finger control. Therefore, children must learn each skill step by step and individually. And the eighth important condition is skills should be learned one at a time. Trying to teach multiple motor skills simultaneously leads to confusion, slow progress, and poor mastery. Children perform better when they focus on one skill at a time. One skill at a time, because whether it is buttoning a shirt or shoelaces or holding a pencil, one skill at a time, parents and teachers allow that only. Each skill demands a different muscle group and coordination pattern. For example, if a child tries to learn both tying shoelaces and buttoning shirts on the same day, they may feel overwhelmed. But learning shoelaces for a week and then learning buttoning the next week leads to better results. Similarly, in sports training, coaches teach basic dribbling first before introducing passing or shooting. Mastering motor skills is a systematic process shaped by readiness, opportunity, practice, guidance, motivation, and careful sequencing. So, each skill requires focused learning, proper models, and developmental support. When these essentials are provided, children grow into confident, coordinated individuals capable of performing complex tasks gracefully and efficiently. Now let's discuss sequence of motor development. Motor development refers to the progressive acquisition of movement skills, beginning from simple reflexes in infancy to complex coordinated actions in later childhood. It follows a predictable and orderly sequence governed by biological maturation and environmental experiences. According to L.H. Burnside and McGraw, although the rate may differ from child to child, the sequence remains largely universal. The development of motor control progresses from, we already discussed it, from head to toe, and it is known as cephalocaudal principle. From the center of the body towards outward, proximodistal principle, and from general to specific responses. Understanding the sequence of motor development helps the parents, teachers, and caregivers support children effectively through each developmental stage. Now let's discuss for every body part the first head region. Motor control begins with the head as the cephalocaudal principle suggests. During the early weeks of life, infants develop basic abilities such as ocular pursuit movements. Within 4 weeks, at 1 month, babies begin tracking moving objects with their eyes. This early visual motor coordination helps them attend to their surroundings. Social smile, 3 months. By the 3rd month, infants respond to familiar faces, for example, caregivers and parents, with a smile. Though social, it reflects improved neural coordination of facial muscles. Eye coordination, 4 months. Infants become capable of focusing both eyes on an object, supporting depth perception. Holding the head up. By around 1 month in a prone position and 4 months in a sitting posture, the baby gains enough neck muscle strength to lift and maintain the head. This is crucial because head control is the foundation for later sitting, crawling, and walking. For example, a 3-month-old lying on the tummy lifts the head to observe a parent approaching. This emerging head control is the first major motor milestone. Now we will discuss about trunk region. After the head, motor control shifts downward to the trunk. Strengthening the back, shoulder, and abdominal muscles is essential for balance and coordination. Turning, 2 to 4 months. Between 2 to 4 months, babies begin turning from side to back and back to side. By 6 months, they complete rolling movements. These actions indicate improved trunk rotation. Sitting, 5 to 9 months with support, 5 months. Pulls to sitting, 4 months. Without support, around 9 months. Sitting independently shows significant trunk stability and balance of the body. Organs of elimination, 2 to 4 years. Bowel control generally develops by 2 years, followed by bladder control between 2 to 4 years. And this sequence also shows maturation of internal muscular regulation. For example, a baby trying to grab a toy slightly out of reach will twist the trunk and roll over. This coordinated trunk movement is a sign of maturing motor control. Arms and hands. The third third organ, arms and hands, fine motor development follows the proximo-distal principle. Control develops from the shoulder outward to the hand and fingers. Defensive movements. Within 2 weeks, newborns instinctively move arms when startled or when something touches the face. Thumb sucking. Emergence of hand to mouth coordination. Reach and grasp. 4 months. Babies begin reaching for objects and attempt to grasp them, though the grip is not yet precise. Grasp and hold. 5 months. A stronger palmar grasp develops, enabling infants to pick up soft toys or rattles. Picking up objects with opposed thumb. 8 months. By 8 months, infants use a more refined pincer grasp, essential for later activities such as feeding, writing, or manipulating small objects. For example, an 8-month-old picking up a small biscuit piece between thumb and index finger demonstrates this particular refinement. Legs and feet. The final major motor control area involves the lower limbs, which eventually leads to standing and then walking. Hitching. Backward movement in sitting. 6 months. Infants push themselves backward by using arms while in sitting position. Although backward, it is a preparation for later crawling. Crawling. 7 months. Pulling the body forward by using arms, legs, assist with pushing. Creeping. 9 to 10 months. On hands and knees. 9 months. On all fours with rhythmic movements. 10 months. Creeping is more advanced than crawling, involving alternate arm-leg coordination. Standing. 8 to 11 months. With support 8 months. Without support 11 months. Walking. 11 to 14 months. With support 11 months and without support 12 to 14 months. In early walking, certain predictable patterns are observed. Outward turned feet, stiff legs, arms held out for balance, and a wide base for support. As confidence increases, steps become longer, firmer, and more rhythmic. For example, a 1-year-old taking wobbly steps while holding a caregiver's finger shows emerging walking control. Now next we will do early walking patterns. Experimental studies describe clear characteristics of early walking and body posture. The body remains upright with motion primarily from the legs. Arms extend outward like a tightrope walker to maintain the balance. Foot position. Feet are turned outward and heels often do not touch the ground initially. The baby, you must have seen, uses the whole body sole. Whole sole as coordination improves. Step pattern. Early steps are short, rapid and irregular. By around 15 months, step length increases and patterns become more stable. Use of eyes. The baby looks forward, not down at the floor, which sometimes causes falls. Vision guides balance and direction. For example, a child beginning to walk independently takes quick, unstable steps with arms up, classic early walking posture. Predictable sequence and developmental laws. Motor development follows predictable developmental laws. Cephalocaudal development controls moves from the head downward. For example, head control, then sitting, standing, and finally walking. Proximodistal principle, control progresses from the center of the body to outward. For example, shoulder control, then arm control, hand and further fingers. General to specific responses, movements begin as broad and diffuse and gradually become precise. For example, first waving whole hand, later picking up beads using 2 fingers. Universal but individually timed. The sequence is same for all children, but timing varies. Some babies walk at 10 months, others at 14 months, but both follow the same steps. Now we will see the importance of the sequence of motor development. Understanding motor development sequence is important because it helps identify developmental delays. If a 10-month-old cannot sit independently, it may indicate a need for early intervention. Here parents caregivers needs to identify this particular milestone and intervene. It guides caregivers to provide appropriate experiences. For example, tummy time helps strengthen neck and trunk muscles. It aids in designing educational and therapeutic activities. Teachers and therapists use these milestones to structure activities in early childhood programs. It helps ensure safety. Knowing that infants use objects to pull themselves to standing, caregivers can prepare safer surroundings. The sequence of motor development is a universal and orderly progression through which infants gain control over their body, beginning with the head and concluding with the legs and feet. From early reflexes to upright walking, every stage reflects neurological maturity and muscular strength. External factors such as opportunities to practice, parental support, nutrition, and environmental stimulation further shape this progression. Understanding these developmental sequence is essential for parents, teachers, and health professionals to support the child's growth effectively and recognize delays at the earliest stage. Finally, we can conclude it. Motor development follows a predictable and orderly pattern shaped by maturation, experience, and environmental support. From basic reflexes to complex coordinated actions, each new skill builds on earlier foundations, demonstrating both cephalocaudal and proximodistal principles. The essentials of learning motor skills such as readiness, practice, guidance, opportunities, motivation, and appropriate modeling ensure that children acquire movements efficiently and correctly. Understanding the sequence of motor development allows parents, teachers, and caregivers to identify delays early and provide timely intervention. It also helps design effective learning environments that promote exploration, safety, and confidence. Ultimately, motor development is a dynamic process, it's ever changing process, it varies from child to child. through which children gain independence, they gain competence and ability to interact meaningfully with their surroundings. There are certain references, you can further go through these references. Thank you. Happy learning.